Do you know that today is World Hypertension Day? Again, do you know that hypertension is a silent killer? If not, then today we are going to have a discussion about what hypertension is. And that is why we have in-house Dr. Med Eugene Befi Ampofo. He is from the physician specialist and cardiology. No, he is actually a physician specialist and a cardiology fellow. Kwalibu Teaching Hospital. I even thought, you're welcome.
Thank you.
I thought that hypertension was for a particular age group. It cannot affect me. Why will it affect me? I think I'm living healthy. I think I am young. I have not reached the age of 35. I have not reached 40 years. So it will not affect me. There's nothing that will even affect me when it comes to my eating habits and everything. How is that true?
Thank you very much. So first of all, I want to say I'm representing the Ghanaian Society of Cardiology.
Yeah,
I'm here with Dr. Setnani.
Yeah.
And so hypertension, yes, agreeably, is the risk factor is higher. It's higher when you are aging, as you said. But the fact that you are young does not prevent you from getting hypertension.
Right.
There are two forms of hypertension. We have mainly what we call the primary or essential hypertension, and we have the secondary hypertension. Now, the primary hypertension, usually, there is no identifiable cause to of the hypertension, and that is usually majority of the cases we see, and that one is commoner in the older age group. However, with the secondary hypertension, as the name stands, secondary, it is usually due to another condition, and that can occur even in younger age groups. For example, you can have hypertension as a result of a kidney disease. So if you develop a kidney disease as a young person from any other cause, that kidney disease can result in hypertension. But in this case, that hypertension is what's secondary due to the kidney disease. Secondly, there are genetic causes or risk factors, genetic predispositions to hypertension, which is irrespective of the age. So if you have that genetic predisposition, irrespective of your age, you can have hypertension. So there are genetic causes of hypertension too. So the age alone, though the younger age group are less likely to be hypertensive, it doesn't protect you 100%.
Okay, you mentioned that you are a member of the Ghana Society of Cardiology.
Yeah, the Ghanaian Society of
Ghanaian
Cardiology.
Society. So give me a brief history or a brief introduction.
Thank you. So the Ghanaian Society of Cardiology is a non-governmental organization made up of health professionals, mainly cardiologists. Cardiologists are specialists who have keen interest in the heart and trying to protect the heart, essentially. And we have non-cardiologist members also as part of it, allied members, and it's been officially inaugurated since 2017, and it's made up of all cardiologists in the country. And our goal is to touch hearts and shape practice, and to create awareness and prevention and improvement of cardiovascular disease management in the country, essentially.
Right.
So that is what the Ghanaian Society of Cardiology is about. Our president is Dr. Collins Kokro. He's a cardiologist at Citi Teaching Hospital.
That's amazing. Now, you came in with a gentleman, also a Dr. Med. Yeah, Seth. How are you this morning?
Fine, thank you.
You're great.
I'm doing well.
You're doing well. Okay. Now, what is the relevance of this whole World Hypertension Day, and why are we even celebrating it or creating an awareness for it?
So, as you started by saying that hypertension is a silent killer, therefore, we need to create that awareness, or many people will not really get to know that hypertension really carries with it so many problems. And so, the world over, the organizations involved in dealing with hypertension, like International Society of Hypertension, they actually came together and then realized that we need to create awareness. And so the 17th of May was actually earmarked. And so for every year, 17th of May, we go out across the world trying to tell people the effect of hypertension if you don't pick it up early. And there is no way you will know you have hypertension if you do not measure your blood pressure. So it's creating the awareness and also to make sure that these people get to know. And even if you find out, I mean, that's not the end of the world. You can control it very well and enjoy your life, basically. So that's what the World Hypertension Day is all about.
Dr. Med, I know the theme is measure your blood pressure accurately and then control it and live longer.
Yeah.
How do you marry that with the measurement? A whole measurement thing. I do not understand. Do I have to measure my blood? Or
I like that. No, it's not. We just, blood pressure actually talks about the pressure at which the heart is pumping blood out of it to every organ. So there's a way we can measure the pressure at which it's working. So there's a normal blood pressure for all of us, and it's pegged at 120/80. So basically, if you go above this figure, when you get to 140/80, then we say you have hypertension. And it's just two figures we are looking at. So we have the apparatus here. So anytime we measure it, it gives us two figures. So the top one is the systolic, and the lower one is the diastolic pressure. The top one actually signifies the force with which the heart contracts and pushes the blood out of the heart itself into the vessels. And then the lower one is the diastolic, or the diastolic pressure. That's the pressure that the body maintains when the heart is relaxing. So we say the normal should be 120/80. When you go above the 140/90, then we say, or at 140/90 and above, we say you have hypertension. And that is where the body starts to actually feel the impact. And so we measure it using the apparatus. We don't take blood. It's just a measurement. And there's a way to measure it accurately.
Really?
So some people go about using all sort of devices. They put a device at various points of the body.
Okay, I'm not stopping you.
Yeah.
So please, let's try it on me and let's
Okay,
see if it's working.
So, but to
That's
start with,
anytime I enter hospital, this is what I do.
oh, yeah. That's great. Yeah. But to start with, you are not sitting appropriately.
Ewo.
You need to sit. We can demonstrate. So
Please
you sit. You sit straight with your back straight, your legs on the feet. No, not straight.
I should remove my heels.
So it's flat on the ground.
Okay.
And basically your hand should be at the level of the heart. So if you do this here, you are not going to get an accurate.
Right.
So your hand has to be, it needs to rest on the table just at the level of the heart.
Oh.
And then we place the machine on that.
We can use this?
We can use this?
It's low, but we can.
It's low, but...
Okay.
Whoa.
Okay.
Okay. Great. So we don't have the perfect setting here, but we can still. So you put your hand in, right, and then we put it mid section of the upper arm.
Okay.
Basically, what we need is that it shouldn't be. We have values we are looking at, or the percentages. So we are looking this, the curve actually will give a figure with respect to your size arm. So we need it to go around the hand, the circumference, about 80%, and then the width should be about 40% of this. So if you use a smaller curve, you are going to actually get a higher pressure. If I use a bigger curve, then you're going to get a lower one, even though your blood pressure is high.
Wow.
So we must also choose our curve very well. So let your hands, as if this is the table, it will be resting on the table. This goes right on there's an artery that actually goes right here. So we put it on it. So there's a mark here to tell us where this should be. Yes. And so it has to be on it. And then we actually tighten it, and your hand will be resting on the table.
Okay.
And you are also, and then you shouldn't, before coming for the measurement, you shouldn't have taken coffee within the last 30 minutes. You come in, you have to sit down and rest for about 5 to 10 minutes.
Wow.
Because activity, caffeine actually contains things that can push the blood pressure up. So you don't need to, and you should keep quiet.
Okay, I've shut up.
No, you have to be quiet. Yes. So, but sometimes when you go to the hospital, I think you can rest your arm now. You go to the hospital and you hear the nurses and sometimes the doctors. We are talking whilst we are. It should not be so. We have to be quiet so that you'll be you'll be at rest basically. So yes, we put in. So whilst we are assuming it's on a table, close like at the level of your heart. And when we have it, then we can now measure it. And then, so let me start it. Your hand is hanging, so we may get...
I think she can rest it.
Okay, so you rest it. And let me also leave it.
It can be left there.
Yeah.
Okay.
So we leave it on the table at the level with your arm and the machine, everything at the same level, basically. So it's reading now.
Okay.
Yeah.
Okay. So, Dr. Eugene, how can you tell if someone is hypertensive? That is, what are some of the symptoms that can show the person is hypertensive?
Thank you very much. As my senior stated, it's a silent killer. So if you are waiting to have symptoms, then it will be late. You understand?
You take it.
Oh, boy,
so basically, the most common presentation of hypertension is no symptoms.
There are no symptoms at all?
Yes, that's the most common presentation. And that's what makes it scary.
Wow.
If you are waiting to have symptoms before you get diagnosed of hypertension, it might be late. So the commonest presentation is no symptoms, what we call asymptomatic. And that's why we recommend the screening, routine check. Because if you are not checking, you will not know. Now, when you start having symptoms, what kind of symptoms will you have? Most at times, when you start having symptoms, then it means it's complicated. So I'll start from the head to downwards. The first time someone may know, which unfortunately is what is happening most of the time, is when someone comes with an acute stroke.
Right.
And that is when the person gets to know that he or she has hypertension, unfortunately. And because most of them are coming with very high blood pressures at the time of diagnosis, the younger age group, they are coming with the stroke that is associated with bleed. Like the artery that supplies the brain, they burst and it leaks blood because we are coming with very high uncontrolled blood pressures. So that may be the first time. Unfortunately, we see that on the daily. The first time someone gets to know they have hypertension. Or the first time someone gets to know they have hypertension is when they come with heart failure.
Wow.
So he comes with difficulty breathing, he can't breathe, and the lung is flooded with fluid. And you check the blood pressure and it's high. The first time someone will get to know that they have hypertension is that they notice their feet is swollen, or they wake up in the morning and the face gets swollen. They go to the hospital to complain, they check their blood pressure, it's high, and they already have kidney failure. The first time someone gets to know they are hypertensive is that they notice a change in their vision. They go to the hospital, they see an eye specialist, they check their eyes, and they say you have what we call hypertensive retinopathy. The BP is high and has damaged the arteries and the vessels of the eye. So if you are waiting to have symptoms before you get to know whether you have hypertension, you are likely going to be diagnosed with a complication.
Oh, wow.
And at the time of diagnosis, it even becomes difficult to control the blood pressure because most of these complications worsens the blood pressure control. For example, in patients with kidney disease, getting their blood pressure under control is difficult. Why? Because the kidney also plays a role in blood pressure control, and the kidney already is struggling. So it becomes a cycle, and it keeps going. So we're encouraging people, get your blood pressure checked. Fortunately, this machine is available. You can buy it in pharmacies, and they can teach you how to check it.
Right.
If you can't, you can go to a pharmacy, and they will check.
They'll check it for you.
And the pharmacists are educated to advise, to counsel. So based on your recording, they may tell you this recording is normal.
Right.
So check in maybe in 6 months. Or this recording requires the attention of a doctor. So go and see your doctor.
Awesome.
The problem is if you don't, and let's say there's a secondary cause to the hypertension, as you asked earlier, in the younger age group, that secondary cause, for example, if it's a kidney disease, also progresses and at the time of diagnosis may be at a stage where we cannot salvage it.
Oh, right. I'll come back to you. So what are the causes and how can we prevent it?
So just like my colleague said, I mean, the two types, the primary or the essential, and then the secondary. For the secondary ones, he's mentioned some causes like kidney disease. Sometimes we have what we call the thyroid. All of us have it.
Yeah.
It overworks, and then you can have hypertension. And the other organs that can have other issues that will manifest as hypertension. But by and large, most people, as he said, will present with their primary hypertension. And we don't really have a cause for that. There are risk factors that predispose people to having the primary hypertension. So in that regard, we'll talk about the risk factors. So some of the risk factors can be grouped into two: the modifiable ones and the non-modifiable ones. The ones that you can modify, I mean, we have weight gain, dietary intake, sedentary lifestyle. I mean, you have the power to do something about that. And then for the non-modifiable ones, aging. We are all going to grow.
We're all going to grow.
Whilst we are growing, the arteries become a bit stiff. And then also family history. If you have a very strong family history of hypertension, the chances are that you might also get hypertension. And then sex or gender. I mean, it's difficult. Nowadays, we need to be careful. But we know from the books that the male sex actually predisposes. And then we also have the sex. We've spoken about sex. And also, if you've had any complication or you've had anything like diagnosed of hypertension before with any complication, it tells us that basically you are not going to come down again.
Right.
So yes, so those are, if you have a personal history related to hypertension, yes, that's also part of it. You cannot modify those ones at all.
Right.
Yes.
Dr. Med, can we know if there's a cure, and is there any available sort of medication for it?
Okay, to set or to me?
Oh, no, to you.
Thank you. So now, when it comes to I want to use the word management than cure, but I'll answer the question. So there can be a cure of the hypertension, depending on the type of hypertension. Like I said, we have secondary and primary hypertension. So for example, if someone has a disease of a thyroid gland, okay, and the thyroid gland is overworking, producing too much of the hormone, and it goes into a state where we call hyperthyroidism, and that is picked up early and treated, the hypertension can go away. You understand?
Right.
So if there's an identifiable secondary cause, and it is identified early, and that secondary cause is treatable, the hypertension becomes curable. That is why when you have a young person with hypertension, you want to look for a secondary cause quickly, and if that secondary cause is treatable, you treat it and the hypertension goes away.
Right.
But if it is primary or essential hypertension, there is no cure for it, but we can manage it. We can get it under control. How do we get it under control? We have the medications, and we have things other than medications. So medication, we say, is pharmacological, and we have the non-pharmacological.
Right.
And as my senior rightly said, you know the risk factors. So those are modifiable. It's part of the treatment. So if the person is overweight, he needs to lose weight. If he's obese, he needs to lose weight. Losing weight alone can help your blood pressure come down without medication.
Right.
Exercise helps with blood pressure control. Dietary changes are part of the weight management, and that even also helps with the blood pressure control. Salt restriction. This is not to advertise, but we all remember this advert. Where Duraplast goes,
Water flows.
Water flows. Yeah. So wherever salt goes, water will follow.
Stagnates.
Now, your blood pressure is a product of volume times and other parameters. So if you take in a lot of salt, essentially your blood volume increases, and that predisposes you to hypertension.
Right.
So you cut down on your salt. With respect to medications, there are various groups of medications that we use to manage hypertension. I would not want to go into the names and the mechanisms, but there are medications that we can use to treat hypertension.
Right, it's been amazing having you two here. We had Dr. Med Eugene Befi Ampofo, physician specialist and cardiology fellow, Kolebu Teaching Hospital, and also Dr. Med Seth Yaunani, Senior Physician Specialist and Cardiologist, Ghana West Municipal. But they all belong to the Ghana Society of Cardiology. And since today is World Hypertension Day, make sure that you are checking your blood. Your hypertension may even go away. It can be cured. So please make sure you are going to the hospital to check it.